Um, Welcome everybody to, believe it or not, our eighth 78 Connect. I can't believe we've done 8 of them. Um, and by the way, meant to say welcome on behalf of all the class officers. And one of the things that I have really loved about 78 Connect is like getting to know you guys all as adults, and not like screaming over, in a loud tent for 2 minutes before you move on to the next person, but actually getting to spend time and hearing what our classmates are doing has been really fun. And everyone who presents, I either think, I wish I'd been friends with him, or why wasn't I friends with her? Like it's been really, really fun. And I continue to be so impressed with the range of, what people are doing, their interests, their passions. Who knew we were like such an interesting class? So I'm thrilled. Little housekeeping for tonight. Tonight we have Dr. Richard Usatina, who's going to talk to us about homelessness in America. But just to let you know how the evening is going to go. So Kevin O'Rourke, our classmate, is going to be moderating the discussion with Richard, and then he'll be the one who's doing the Q&A with the class afterwards. But we're going to take a little break between their conversation and the questions from the class, because as we've said in the email that went out on this last invitation, we have several classmates who are very interested in discussing anti-racism, and certainly couldn't be more timely. Unfortunately, it's always timely. And so we're going to take a little turn in our programming, and Pam Jennings and Mario Chipetti and Brent Shea are all have been working on bringing different things to the class. So after this, 78 Connect's going to go on hold for a little while, and we're going to see how some of this other programming pans out. So Pam is going to talk to us in between. Pam, I haven't discussed the timing, but hopefully this works for you, that we'll break in the middle before we start the Q&A, because I don't want to leave it till the end and if people have to leave after 8, not have them hear what to expect. So I'm very excited to hear about what's coming next. But for now, let us proceed with this program. So Kevin, I turn it over to you.
Thank you very much, Kate. Welcome, everybody, and thank you for coming again. I just want to introduce our guest tonight. Richard Usatin is a professor of family and community medicine, dermatology, and cutaneous surgery, as well as an assistant director of medical humanities education at the University of Texas Health Science Center at San Antonio. As you all know, he graduated from Williams in 1978, and then he went to medical school at Columbia. In 1984, Richard began to provide health care to the homeless people at the Venice Family Clinic, a free clinic in Venice, California. He delivered health care to the homeless of Los Angeles, both in that free clinic and in the surrounding shelters. And Richard was also the medical director of a full-time free clinic in the largest homeless shelter on Skid Row of Los Angeles. He then established 2 student-run clinics for the homeless families and individuals with the medical students of UCLA. Richard states that, quote, the passion and motivation of the students to serve this vulnerable population has been a tremendous inspiration to him throughout his career. He continues to work with the San Antonio community to this day through Haven for Hope and the Usatin Wellness Center, named in his honor for the work he's done caring for vulnerable populations. In 2000, he received the Association of American Medical Colleges Humanism in Medicine Award. Now, this award recognizes one medical school faculty physician in the nation who, quote, exemplifies the qualities of a caring and compassionate mentor in the teaching and advising of medical students. Now, there's no doubt that Richard has devoted his life to providing compassionate care for underserved populations nationally and globally. His work has been amazing. For 36 years, he's worked with individuals and families experiencing homelessness, and he acknowledges that their stories and their lives have touched his heart and soul in profound ways. I should also point out that Richard's passion for photography has led him to create over 25,000 clinical images now being used in books, monographs, journal articles, and educational websites. He'll be sharing some of those remarkable pictures in tonight's presentation as he shares his work with us. So that's my spiel to introduce this remarkable classmate of ours, and it's my pleasure to welcome Dr. Richard Ucitine, and on behalf of the class of 78, thank you for your incredible work, Richard.
Thank you, Kevin, for all those kind words. And it's really a pleasure to see you all and some of you just to see your names. And I know you're here with us. And as I see you all, I know that you're all in homes that are warm, that are dry. You have no problem getting 3 meals a day, maybe even some snacks in between. And we're all so lucky, you know, we are all so fortunate. We're fortunate that we had an education at Williams, and we went on to do other things. And, you know, I've heard so many remarkable stories from our classmates over the last year that we've been doing this together. And so it's just great to be here to speak to you. And so I know Kevin has questions, so I'm gonna let Kevin ask the questions, and I'll try and provide some answers and show some pictures, and hopefully we'll all learn together.
Great. I want to start out by addressing some of your history and how you began in working with the homeless population and the at-risk population. I know that you started in Venice, California. Can you talk a little bit about how you got involved and what provoked you to jump into this incredible work that you do?
Well, actually, it started at Williams because when I was applying to medical school, I knew that I wanted to work with the underserved. And so I applied for a National Health Service Corps scholarship. And so the National Health Service Corps paid for my 4 years at Columbia, which was great because it was going to be very expensive. And I really didn't come from a family with a lot of wealth. So it was really fabulous that the government did that. But then I had to pay the government back by doing service. And so it's a great thing, you know, paying for education and then doing service. And the service that I did once I finished my family medicine residency was at the Venice Family Clinic. And they were starting a healthcare for the homeless program. And I got to be involved at the ground level. We hired a wonderful nurse, Mary Smith, who had been working on Skid Row with homeless people for years. She taught me a lot about the population, about how to provide care for them. And it, you know, went from there to something that I've just been doing my whole career. I've done many things. I've written books. I've developed websites and apps, and it's really been a great career. I would have done it the same way if I had to start over. But caring for underserved and vulnerable populations has been very rewarding, and it does warm my heart. It does give me a great sense of satisfaction, and I had this great opportunity to do it throughout, you know, these last 36 years.
And you want to talk? Can you talk to us a little bit? I know you have some materials that you want to share with us, but can you talk a little bit about the major causes of homelessness?
Sure.
And are there systematic underlying reasons that contribute to the homelessness in this country
Yeah, absolutely.
versus
So,
other places?
yeah, so Kevin and everyone, you know, if you think, as we think about the homeless, even if the people that we see on the street, sleeping on the street or coming up to our cars, mental illness is like number one. And we just do not have a really adequate mental health care system in our country. So uh, it's kind of an open air asylum. We have so many people who are mentally ill, and they're not getting treated, and they're on our streets and sleeping in the doorways and wherever else. So that's a big cause. And then what what goes along with that is the substance abuse disorder, the addiction, because many people use the drugs to treat their mental health problems, so they're self-medicating. They don't like the antipsychotic drugs that we give them because it gives them other kinds of side effects. It maybe takes away their creativity and other things that they'll say they don't want, those drugs, but, methamphetamine, it makes them feel good, or heroin takes away some of their pain from maybe childhood trauma. So people are using these drugs, and that's another big cause. But there's so many things. I mean, there are economic issues, multi-generational poverty, people who are just living on the edge. And, if you're making a minimum wage in this country, $7.25 an hour, you can barely afford to have a place to live. And some people will be indoors part of the month and on the street the other part, because even with a job, a low paying job, they can't afford, full-time indoor space to live. So those are issues, but I mean, there's so many factors. There's people who get physically ill, and without health insurance, they become bankrupt. And that can lead to homelessness. Any kind of unemployment, losing their job during our pandemic, people have become homeless. Just the poverty. We haven't done a very good job with treating poverty, child poverty in our country. Lack of affordable housing, natural disasters, and I'll show you some pictures later of Hurricane Katrina and how people became homeless after that. But right now in Texas, last week I live in Texas, San Antonio. We had 5 inches of snow. I wanted to break out my cross country skis and use my Williams skills of cross country skiing here, but I unfortunately gave them to my son-in-law in Minneapolis, so I didn't have them. But we got, the snow was lovely, but it also created great problems that we still to this day don't have hot water in part of our home because our pipes broke underneath our house. And a lot of people lost energy, water, and they couldn't get a hotel room at the highest price hotels in town, or any hotels, because they were full. And so many people lost their housing temporarily. I'll just mention a few other things. We've got wars and violence, refugees who are homeless, people living in refugee camps, and then child abuse and neglect are big causes as well. So that's just a few to mention, to get started.
And what about the healthcare system? And are there solutions that we can that will help us address that?
Yeah. Well, I mean, we need to devote some money and resources to mental health. So many people do not have access to mental health care. If you're uninsured, it's very hard to get mental health care. We don't even have enough psychiatrists in the country for those who are insured. So and I know that because I'm actually on the board of directors of the mental health authority for our county. So I know how hard it is to find mental health professionals to do the work that is needed. And we don't have the money, we don't have the resources. The states, the federal government, they underfund mental health, and they totally underfund substance abuse care. I work with a place called Alpha Home, and it's women in recovery from substance abuse, and they're really wonderful women to work with. They're inspirational in their strength to get off of the meth or heroin or whatever they've been using, or alcohol for that matter. And there are 40 beds in the whole facility, and there are so many women in San Antonio that need help with their substance abuse problems. So we just don't have, we're not putting the resources into what could help prevent homelessness.
And what about the pandemic? Because there's obviously resources being directed
Yes.
in that regard.
So it's actually, yeah. So with the pandemic, there's some odd things happen. Like hotels became empty in some cities because of lack of tourism. So actually, some of the cities were able to use those empty hotel rooms to house people who would otherwise be on the streets. The people who are in the largest homeless facility in our city, they are actually not doing too badly when it comes to the pandemic. There's been very few cases of coronavirus or COVID-19 in our large homeless transitional village. About 12 to 1,500 people living there every night. We're a relatively small city. We're like the seventh largest city in the country. I mean, there are many more people in LA and New York, San Francisco that are homeless, but they have not had a high rate of COVID-19, mainly because they're isolated. They're not traveling, across the world, and we were able to actually keep volunteers from coming in order to keep people from bringing in COVID-19 into the shelters. So in terms of the pandemic, they fared okay if they were already homeless. However, people who are losing their jobs and unemployment are certainly now at risk of becoming homeless. And it's fortunate that there are programs that people are not having to pay their rent and they're still not being evicted. So that's helping people. But if that doesn't go on, we're going to see more homeless people.
I also want to, and then we'll get to, because Sue has sent me a question too. But I know you want to get to your photographs and to your PowerPoint, Richard, and I want to have you do that.
That's fine.
Before we do that, I want to set up a couple of more things, because I think we all understand. Well, I shouldn't say we all understand. I think we're all aware of the homeless situation and the tragedy that is, especially in this country, the most wealthy country in the world. But especially with the children and what's going on, can you just talk about a little bit about that and families and how it affects families, and as
Yeah.
an offshoot, how it affects communities?
Yeah. So I think originally most of us think of homeless people as single males, alcoholics on the streets in skid rows of our cities. But the largest growing population of homeless or people experiencing homelessness in our country are the families. And those kids are traumatized. The kids have a higher rate of developmental disorders, of school failures, of ADD, attention deficit disorder, all kinds of mental illness, and they're scarred. Um, they are amazingly resilient, and as I meet them and work with these lovely kids, and who need love and attention, but they also, will be affected for life. I once had a young man come to a interview for our residency, and he was in his last year of medical school, and he told me how he had been homeless when he was growing up. There was a time when he was in a shelter with his mom, actually in San Diego, and I was in LA at the time. And I just thought, wow, this kid was so resilient that here he is applying to, you see, he's actually in medical school applying for a residency. But that's not the norm. That's the exception. Most of the kids don't graduate high school and live in poverty, and are more likely to be homeless than the rest of the population. So it really takes a big toll on our kids. And it's really, I don't know if we're going to call it a sin or a shame, or it's shameful that in this wealthy country that we can't do better. And Kevin, you mentioned that I've had the opportunity to do global work. I've worked in Africa and Central America, we taking medical students and doing mission trips. When I see such extreme poverty in these nations, in Ethiopia in particular, the extreme poverty that people live in, there's no electricity, running water, mud floors. Walk into a hut and there's a cow there with whatever the cow does on the floor. That's not the USA. Most of us do have running water and electricity most of the time, but we could do better. We shouldn't have people living on our streets and and living in shelters. We can do better. And we'll talk about some of the things I think we can all do to try and deal with this problem. So yeah, let me let you ask the next question. Okay.
I also, there are a couple other things. I know you want to share some of your photographs, and maybe we'll do that, but I want to ask this question that someone asked about other countries' health systems. Are there countries that do a better job than we do in this country?
Well, I think that certainly the Scandinavian countries do. Countries with,
Why is that? What do they do differently than we do?
well, everyone is entitled to health care. Health care is a basic human right there. Um, you know, Education, I think, is more available to everyone, regardless of their, um, how, what kind of wealth their family has. And they just have a better social safety net than we do. Our safety net is full of holes. It always has been. Lyndon Johnson, a fellow Texan. I'm not really. I'm a New Yorker who moved to Texas, but Lyndon Johnson, had a war on poverty in the 1960s, and unfortunately, he got all distracted by his war in Vietnam, and the war on poverty didn't do very much. I mean, some things were passed, Social Security and Medicare and Medicaid, but that's not enough. And even Obamacare, which should have provided a lot of health care for people across the country. I live in a state where they refuse to take Medicaid expansion, so we have the largest number of uninsured in the country are in Texas, and it's horrible. I know we can do better.
Now, finally, before we get to your PowerPoint, I want to address your work with medical students and establishing the free clinics and the way you mentor those students. And it's amazing work. Can you talk a little bit about that? I know it started at UCLA first, right?
Yes, well, that's where I did my residency, and then I stayed for another 17 years. I was an assistant dean of student affairs when I left UCLA. But I've really enjoyed working with the medical students. They inspire me every day. They're the ones who came to me and asked, could we start a clinic they're going to be families that are moving into these 14 trailers on the side of the I-10 freeway in LA. And I'd like, they say, could we go out and give them free healthcare? And I said, oh, well, I could give it a try. I've done it at Venice Clinic. I could try it out there with the trailers. And so we did. And then, what happened in Santa Monica, there were so many homeless people in Santa Monica. If you got to be homeless, it's not a bad place to be homeless. Got that beautiful beach and great views. But, they're living on the streets and they're not doing that well. So there was a Santa Monica shelter built, San Moschel, which actually was like a big tent. And the students said, let's go and do that there too. So we did. And then they wanted to do a mobile clinic on the streets of LA. So we did that. And I did that with them for these 17 years. And when I came to San Antonio, there wasn't a program like that, but I gave a presentation to the students one noon time, and the presentation was about healthcare for the homeless. And students came up to me afterwards and said, can't we do this here in San Antonio? I saw you did it at UCLA. Can't you do it here? So we did. We started a program here. And it was so popular that the students, when we'd open up the spots for them to sign up, like within 5 minutes, they were all filled. So we had to open a new clinic. And now we actually have 6 free clinics in San Antonio. Our students they run them for the refugees. There's an LGBTQ clinic. There are more than one clinic for the homeless families. Our students are fabulous. And as I say, they inspire me. They keep me young. And so, in fact, they're now, of course, the age of my children, but they still keep me young. I love working with them, and I've mentored probably thousands at this point, and you know, what a great privilege it's been.
That's amazing. Well, listen, I have one more question for you, Richard, and that is, what can people do? I mean, what can we do as people in this country, as
Yeah.
responsible, intelligent uh, citizens of the world? Is there something that we can do to help?
Well, there are certainly many things, and I'll mention a few, and then I actually have a slide at the end of them. I'm used to using PowerPoints for teaching. I, I love the technology, but a few things are, you know, one is, you know, be an advocate for social justice and human rights. I mean, this involves so many things, you know, the work on anti-racism, uh, work on, you know, this issue of mass incarceration. We could do better there. Um, we can all advocate for better mental health care program. Just having health insurance for everyone. That should be a basic human right. And so we can be advocates. We can vote. We can vote for people who believe in these things. Um, we can vote for people who believe that refugees and immigrants are people that deserve care and shouldn't be um, excluded from our society. We could volunteer. There's many ways to volunteer with organizations and nonprofits. We can donate money, clothing, furniture. So those are some things that come to mind. But I'd love to tell you more about the people that I've been caring for, and if I could show you their photos and tell you some of their stories, I feel like I could do that at this point. Kevin, do you have something else you want to show ahead?
Yeah, that's
Okay, so I'm
great.
gonna share my PowerPoint, and hopefully the technology will work as it should. So let's see this here. Okay, do you see my PowerPoint? Good. Okay, so I took this photograph in the 1980s in Los Angeles, and I think this is sort of the stereotype of what we think of the homeless man, single man on the street. But I'm going to show you others and other people. So, okay, so this is just a summary of the major causes of homelessness, and I already went through this, so you can take a peek. I'm happy to share this PowerPoint with you later. I didn't get into this in as much detail as I'd like. I don't want to forget that adverse childhood experiences, what we call ACEs, we know this is a risk for homelessness. Foster care is. The racism, our caste system. If you haven't read the book Caste, I highly recommend it. Mass incarceration, wars, PTSD, veterans are higher risk of becoming homeless. I didn't mention that. There's a whole section of the VA that deals with homeless vets, lack of affordable housing, and climate change. You know, we talked about climate change last time we got together, but the severe hurricanes, the floods, the fires, people are losing their homes. You know, even people with money are losing their homes. And then our pandemic. So this is a quote that I like, and I'm gonna I think I'll just have you look at it instead of reading it out loud, since I know you all read. You couldn't have gotten into Williams without that skill. So I'll let you read that for a moment and give me a chance to take a sip of water here. My psychotropic meds keep my mouth dry, so it keeps me off the street too. Okay, let's see if we can get this to move forward. Okay, sometimes I'm having trouble with that. Oh, there we go. So I like this quote from Mahatma Gandhi. The true measure of any society can be found in how it treats its most vulnerable members. And really, the homeless in America, they are our untouchables. They are our most vulnerable members. Of course, they're not the only ones, and there are many reasons why people are at the bottom of our society, but homelessness is one of those. We need to deal with this inadequate systems to treat mental illness and addiction. People become bankrupt from the cost of healthcare that they can't pay for. And of course, we've had a pandemic in a leadership vacuum, especially last year. This is a picture of where I started. It's appropriate that it's in black and white because it feels like it was a long time ago. This was the Venice Family Clinic, general medical care for the whole family. Most of our population was the working poor or the homeless, and they would line up for hours before we'd open in the morning. And it always bothered me that people had to stand in line for healthcare. One of the things I worked toward was getting an appointment system so people wouldn't be online wondering whether they would get in and be seen that day. This was, by the way, only 6 blocks from this beautiful beach in Los Angeles, looking out toward the Malibu Mountains. And a few miles from Skid Row in LA, I took this photograph on a tour with Mary Smith, my nurse. This man who's lying there after drinking whatever was in that paper bag, which was most likely alcohol. But the real face of homelessness is not just that man lying on the street, but this woman and her child. I saw her in our Skid Row clinic at the Union Rescue Mission. A lovely person, but there are many reasons, as I've talked about, that people become homeless, and she was homeless. There was a homeless man. He kind of fit in with the Venice culture. There was always this guy on roller skates riding around on the Venice boardwalk, singing and playing his guitar. This wasn't him. This guy unfortunately had schizophrenia. He did think he was Jesus Christ, and this is how he dressed. And he made his own his guitar on this piece of wood that he found, piece of driftwood. So it's the kids like this that we see, and the families. And this is a very poor quality image because I took this on my first digital camera. It actually used little floppy disks. It wrote to floppy disks, and a Panasonic. And I took the picture of this woman, and these are all 4. She's only 21. She's got 4 children, each child from a different father. Cocaine addiction was the main reason for her homelessness. And she came out to LA after she was kicked out of her mom's house, and she was unhappy. So I showed this picture to her, and she looked at it and she said, boy, I really look depressed. And I said, yes. And, we're of course trying to provide her care because along with the kids. And she said, please tell my story to everyone that you show the picture to. And you have my permission to show this. This is a woman with mental illness, living in a very small space on Skid Row. I do a lot of dermatology, so bear with me for a moment. This woman's itching and scratching, and everyone says she's got scabies, and she keeps coming back with scabies. And she never really had scabies because when I finally talked to her, she said she could see the bugs that were on her, and scabies are microscopic. So we looked close up at her clothing, and these were body lice that were living in the seams of her clothing. And once we got rid of her clothing, got her new clothing, she was no longer scratching and itching, and she no longer had body lice. This woman came to see me, and she had already healed to the degree that this was the picture that I took, but she had this picture on her phone that she shared with me. Pain. And, that many people who are experiencing homelessness are in pain for some reason. They don't generally choose to be homeless. So they don't say, oh, I think I'll be homeless today. I'll just leave my home and live on the street. So her pain was so great, her psychic pain was so great that she was finding a way to numb it. And one of the ways besides drugs is to cut yourself, because when you feel the physical pain, you don't feel the psychic pain as much. And this woman let me take her photograph here. And these were scars from her beatings in her childhood. And she said, this is, my aunt did this. My parents left me with my aunt, and I grew up and I was beaten regularly. And these were the scars that she had. And so when I show this picture, I say, you know, let's don't judge people who are homeless. Let's think about the fact that there are these adverse childhood experiences that lead to addiction, that lead to mental illness, that lead to homelessness. This woman who I saw on Skid Row, and she's got a big smile, very lovely. But this is the other side. This is the big scar where she had been hit over the head with a 2x4 by her husband, and she was escaping domestic violence. Again, everyone lets me use the photographs. I ask them, can I take your picture? Can I use it to teach, to tell your story? This woman, Spanish speaking only. Fortunately, I actually learned to speak Spanish over the years. I wish I grew up speaking Spanish, but starting at 4th grade, I was in a Spanish class and never knew it would come in handy until I moved to actually New York, and even medical school. It was great to speak Spanish, but I do now, and I did in LA. And this woman speaking to me in Spanish told me how she escaped her husband. She's from Central America, but she showed me the photograph. This was on her phone as well, and that was the photograph of after she was beaten and she was escaping domestic violence. And this woman who came to Alpha Home for drug recovery, for chemical dependency treatment. And I took this photograph. She let me take the photograph and told me the story of how she wanted to get treatment, and she was in a relationship, but the man that who she was living with did not want to stop using drugs. He did not want her to stop. He did not want her to leave, so he beat her up. But she left anyway. And that's her at the end of treatment. A different hairstyle and a big smile. No more bruising. Going back to Venice, this is Venice. This is the a little church that let people sleep on the pews of the church when they were homeless. You can see the old cars. This goes back to the 80s. And this woman and her kids were homeless and living in this church. And the same family, a different family, obviously. This family, same church, different family. So we see, it's not only white, it's not only Black, it's really everyone is at risk, and there's a whole family, maybe multi-generational, all living in homelessness. And these kids who are living on Skid Row, it's very scary looking at these kids up on that balcony there. It looks like they could slip through at any moment. They actually have a home, but how safe is their home, and how safe is their life? I mean, I would call this neglect. If my kids were on a balcony like that without supervision, I would be very worried. Or my grandson, I don't think he'd be found out there without supervision. Where do people live when they are homeless? Well, they do come into shelters, but some of them actually have pretty nice tents. This is rare. I took this photograph because I was impressed by the tent and the nice looking bicycle. So the person had not bad for the street, a good tent and a mode of transportation. But most of the way people live are going to be under tarps and under cardboard boxes. In my work in Ethiopia, I took this photograph of people who are, again, I would call this homeless. These are not what I would call homes, but it's not that different from what we see here in the US. Uh, Out on Skid Row, this was one of the rooms of the Union Rescue Mission. You can imagine all these people, you know, this is during the day when they're kicked out. They're not allowed to stay here during the daytime. They have to go out on the street. But they're living, you know, head to toe, you know, one on top of the other, so close. Uh, this is a great place to spread a pandemic. And they did. They had epidemics of hepatitis and other kinds of problems in these shelters. This family was living there, and this family, and this woman who was one of the first women that I saw that was HIV positive. You know, my generation of doctors, when I became an intern in 1982, we were seeing all these young men coming in and dying of HIV. Actually, I should say AIDS. We didn't say HIV. HIV meant we knew the cause. We didn't know in 82 the cause. We knew they had AIDS. They had something wrong with their immune system. It wasn't until a few years later that we found the virus. I say we, the medical profession. I don't take any credit for that. But this woman was, actually at this point we did know about the virus, and she was HIV positive from using drugs. And at that point, this was prior to any drugs for medications for HIV. So I'm sure she didn't last the year. She probably passed away from her AIDS. And this guy was one of the most fun people that I have met in my lifetime. His name is Willie. He told me he was the original hobo. And this man was in his 70s. He has been living on the rails, riding the rails since he was a teen. And, you know, his life was the real hobo, you know, with the stick and the thing behind him, and the camps with the fires, and jumping on the trains. And, you know, that he kind of chose that life. I don't know why. I didn't know him well enough to know why he chose that life. But I did ask him, I said, what's different now that you're in your 70s than when you started riding the rails? And his answer was that I no longer jump on the trains when they're moving. I get on when they're stationary. So that was how his life had changed. He doesn't jump on and off them when they're moving. I mentioned the kinds of natural disasters that have caused homelessness in our country. Hurricane Katrina led to many thousands of homeless people. When about 5,000 from New Orleans came into San Antonio, I went out to Kelly Air Force Base, which is where this is, to provide some free healthcare to the people who were arriving from New Orleans, and with our medical students. And this couple told me their story about how they were up on the roof of their flooded building where they had a rental unit, and they created this sign, you know, help, help, rescue us. And they were eventually evacuated by helicopter off the roof. The man had climbed to the roof with one leg because he was an amputee. And so this was a story of amazing, you know, resilience and surviving a catastrophe. This family as well. And you might notice that most of the people who came, who survived Katrina in New Orleans, were African American. They were the people living in poverty who didn't have the easy get out of New Orleans in their car, go stay in a nice hotel. They stayed because they didn't have any other place to be. Another family, a mom and her child from the Katrina hurricane. And this is what the shelter looked like. So this was set up for people. You know, you think about it, you know, I've been to New Orleans for so many conferences and meetings, and you know, I was there when it flooded up to my waist. I knew New Orleans was just waited, you know, it was a disaster waiting to happen. And our country didn't do what was necessary to prevent this. So here are all these people that are homeless. And these are people that are homeless now in Kansas City. And the biggest difference is here the beds are all together, and here during our pandemic, people escaping the cold, here we just have some social distancing going on. But I mentioned to you that isolation actually helped homeless people escape some of the worst of the virus. This was a story in the New York Times. Not my photo, but Jim Wilson took this photo. You know, what's the state of homelessness in 2020 in our country? Here's some of the numbers. You know, many hundreds of thousands of people. You know, we just passed 500,000 people dying of the coronavirus. But here we have over 567,000 people that are homeless in 2019, actually, not 2020. Many are individuals, they're people and families, the chronically homeless, the veterans, the unaccompanied youth. And if you look, more male than female, and almost as many Black as white, which means that 5 times greater incidence of Black people becoming homeless in our country, 5 times greater than white per capita. So many people of color. We see the medical problems, we see horrible dental problems. I mentioned the mental health issues with the children, the homeless youth who have been often physically abused and sexually abused, have been in foster care and group homes and juvenile detention. The skin problems that people have living on the streets, the addiction issues, and a little bit about the students that I've said so much about. This is a young woman, you know, down on her, kneeling down to give this man care for the wounds on his feet. Another young man from the Middle East originally, taking care of this African American family. And that was me when I didn't have gray hair, in the midst of a group of fabulous students years ago. And this was actually a homeless village that we worked with the Salvation Army, and they built this housing for 40 families, and we provided weekly free healthcare to them. And these were the group of students that were the leaders. And I was in the middle when I could grow a big beard without gray. It was those were the days. So, and then in 2005 is when we started here in San Antonio with Amy Cantor, the student who kind of put the whole thing together with the people at Alpha Home, how we turned a convent and an empty closet into a homeless free clinic with the students on opening day. And Amy, who still does this kind of work now in Portland with the family and some of the families and the students. And we would give them immunizations. And even Superman needed immunizations.
Excuse me, Richard, I'm so sorry to interrupt because these are great, but I'm getting a little mindful of the time and we want to be able to have.
We're at the end.
Okay.
We're going to
I
Haven for
knew I
Hope.
was going to get burned by bringing this up like 3
No.
slides. I just didn't know. Okay.
No. We're coming to the end. I know time is short. So some of the people that we've cared for, this man who lives in a tent with his dog, but unfortunately has lost his ear to skin cancer. I'm just going to read this one statement because I want to bring in the voice of the homeless by reading this woman's statement to us. She said, "So often in seeking medical care, people in my position, homeless, current or former drug addicts, those with mental health struggles, they're met with lack of empathy from healthcare professionals. As I've been working to piece my life back together, I have had so many dismissive, cold, hurried, distracted interactions with medical staff, often leaving feeling more frustrated and hopeless than when I arrived there. This is the first time in our clinic add that in. And I can think of in years that I've met with compassion and care, folks actually listening to what I have to say and responding to my concerns. Above all, I was treated with a level of dignity that brought me to tears. It's hard to feel human sometimes when you're coming from rock bottom, especially when treated with a lack of dignity. It's seemingly small interactions like this that help restore my self-confidence and help remind me that I do have value as a human despite my struggles. And she ended her letter to us as thank you so much from the bottom of my heart. So John Lewis had a few things to say. I'll let you read those. Housing first is one approach. This is not the housing we're talking about. These are the tents that people put up in LA. Here, I'm going to leave it at this slide about things that we can do. And we'll talk about this together. We can also let you ask questions. So I'll stop here and thank you for your attention.
Thank you, Richard. I mean, those are remarkable images, and thank you for sort of touching on the questions that we had earlier. You know what? Before we're going to get to questions, and a couple of people have texted me privately with some questions, and I do want to share those. I know Jackie and Sue. We will get to those. First of all, though, I just want to take a quick break and go to Pam Jennings, who's going to talk very briefly about what the next step is as we step away from 78 Connect and we move towards our outreach and our discussion of anti-racism within the class. So Pam?
Okay. All right. All I'm really going to do tonight is just give you guys a sense of our first offering, which will occur on March 25th, which is a Thursday evening at 7:30 p.m. We are going to have a town hall that will be led by psychoanalyst Dorothy Holmes, and it will address the role of psychoanalysis in the healing of what she calls the fractured American racial identity. This is an identity typified by the expression, "Our country, 'tis of we and them," which Holmes uses to address the othering that is at the heart of racism. I think it would be good to know, for you guys to know that Dr. Holmes is the first African-American psychologist to get training to become a psychoanalyst. Psychoanalysis was very closed off when we graduated from Williams. So she's one of the first, and one of the first African-American analysts to become a training and supervising analyst. She has been pretty much a one-woman show and leading psychoanalytic institutes and training grounds to heal themselves of their racism and to take an active anti-racism stance in their training and organizational settings. There is much that she will talk about that will be useful to us in thinking about anti-racism and the organizations of our everyday lives. And there was a lot in terms of the responses that we got back from the class regarding what they might be interested in hearing more about on anti-racism. There was a lot on this issue of, what actually will we do in our organizations. So expect to hear more from us, and of course, something in writing telling you more about the town hall. Part of our thinking about what will come after the town hall will actually depend somewhat on people's responses to the town hall and what comes up during it. So I don't want to take up any more time, but hopefully that introduces the town hall, and I'm very excited that we're doing it. Okay, thank you.
Thanks, Pam. That's great. we've gotten a great response from people who filled out that questionnaire and who've gotten back to the class officers. So, and I want to thank Pam and Mario and Brent for spearheading that. I also want to take this time before we get to questions because somebody needs to be acknowledged, and that is Kate Stone Lombardi, who has been organizing this 78 Connect and has done an incredible job. I mean, it's remarkable. We are the envy of all the other classes. They were saying, and people are stealing our thunder and trying to steal that plan. But Kate Lombardi, thank you. You have been awesome, and thank you for running this entire thing.
Oh,
So,
thank you, Kevin.
yeah.
That was very unexpected, but I really appreciate it. And thanks everybody for coming and keep coming. So, and can't wait to see what Pam and company have planned. On to the next
Absolutely.
frontier.
Absolutely.
All right.
So listen, we're going to get to questions and answers because I know people have to jump. But Sue, Richard addressed your question. Do you want to clarify that, or should we move on?
My only other question was specifically about the mental health part. I understand that there's better healthcare systems in lots of countries, but in my own experience as a physician, mental health can be very, folks can be resistant to assistance.
Oh, yeah.
And I'm wondering how other countries who do better with homelessness do. Well, I guess it's two-way. How do they do better with their mental health care and therefore have fewer mentally ill homeless persons?
Yeah, there certainly is no magic bullet, Sue, as we both know. And, not everyone wants our medications. That medications do have side effects. Certainly not everyone wants to be in a mental health institution. There's a lot more freedom on the street than there is in some, locked up ward. So, we have major issues, but there's so much more that we can do in prevention. If we dealt with childhood poverty better, if we provided health care throughout, a child's life, and we had, mental health resources available for young people, before they got to the streets, because it's really hard to get someone who's chronically mentally ill and chronically homeless off the streets. It's a lot easier to get them health care earlier and prevent the chronically mentally ill homeless that we see. And the other thing, we can do so much better with our drug policies. Our war on drugs has been a failure. Some countries that have legalized drugs have done better, having safe injection, sites where people can get their heroin, medical grade heroin injected safely and cleanly with a clean needle. It's a lot better than fentanyl on the street. A lot of people are dying from the fentanyl out on our streets now. And I was talking to the CEO of Haven for Hope a few days ago, and he said this fentanyl is so dangerous. He's seeing, not only people are dying of it, but when they're using the Narcan to get them off the fentanyl, he's seeing people get very violent when you take them off the fentanyl. So there's a lot that we can do, and we really have to devote our efforts in these ways. We need to train more psychologists and psychiatrists and mental health nurses. Other questions?
Yeah, Jackie Caldwell had a question too. Jackie, I know that you had texted that. Do you want to ask that question, or should I just read it for?
Well, I guess I could maybe make it a little more succinct. I had the privilege, Richard, of participating in an urban health initiative, and it was a consortium of a number of different schools that had medical schools, universities that had medical schools associated with them. And, it involved Tulane and Charles Drew and UCLA. And we would go to different sites, throughout the year. And so, and one of the sites was actually, you know, we went and visited the mission in LA, and they
Oh,
had
yeah.
this wonderful building that they had built, and you know,
True.
it had a little garden on the top. I was really struck by that. But one of the questions I had is, what role do medical schools play in sensitizing medical students to, you know, social determinants of health and other issues like homelessness and health care for the homeless? I was wondering if you had some thoughts on that.
That's a great
Yeah,
question.
I sure do. Thank you, Jackie, and thanks for the work that you've done. So, and I worked with Charles Drew Medical School a lot when I was in LA. And that's, if people don't know, it is, I guess, a medical school, a traditionally African-American medical school that, you know, in sort of South Central LA to treat the population of that area. Anyway, getting to your question about sensitizing students, one of the slides that I went over really quickly is a slide showing that there is a society of student-run free clinics that is national. Actually, it's international. We have members from China. I was fortunate to be one of the founding members of that with our students. I was a faculty member, and typically about 500 students a year get together and talk about the work that they're doing in their student-run free clinics. And they share their ideas and best methods. And so that's being done by the students themselves. And I would say well over 50% of the medical schools in our country have some kind of program like this.
Mhm.
It's elective. Required, most schools will have something like a doctoring program that we created at UCLA. There's been a model program where they talk about social determinants of health, and we teach them skills of, you know, compassion, you know, treating the whole person, you know, not just treating the disease, but the person. So I think that that's in the medical schools. We could do a lot more. There's no question about it. And I hope we will do more. And I hope some of the events of the last, you know, few years will help medical schools. And I think they already are. You know, there's more talk about diversity in the medical schools. You know, currently most of my work is in dermatology. We need a lot more diversity in dermatology. And there's a lot of talk about that. I'm actually working on a paper about skin cancer and skin of color. You know, there's a lot of things that are happening. The medical profession is waking up. It's long overdue, but I think we're headed in the right direction.
Great. That's a great question. Thank you, Jackie. Sally Fry had a question. And if anybody else just.
Yeah, you want to say it? Unmute. Yeah, there you go.
My internet is sort of unstable, so I hope you can hear me.
Okay, I'm sort of unstable and I can hear you. Okay, I'm kidding.
So I was just going to add in the area of mental health, something that's a personal, a very strong personal bent of mine, which is the whole issue around stigma on mental health. And I just, you know, you guys, I would just say this to everybody, please put on your list too. Please talk about mental health issues more. Just talk about them, just mention them. People hide them so much, you know. I mean, my nephew has borderline personality disorder. He was on the streets. My mother was in a hospital for 7 years with bipolar disorder. Especially my whole life. We just got to talk about it more, because if you talk about it more, people aren't as afraid of it, and also when it gets talked about, maybe we'll get more care and more people putting resources into it. So stigma, it's a big one for me.
Yeah. Thank you, Sally.
Great.
I can't agree with you more. We every family has
That's
issues
right.
with mental health.
Everybody does.
We all do, right? Just like we all have our biases and racism. There's a reason why there's racism and casteism and us versus them, and you know, hatred of the immigrant to the other. And so, you know, we have a lot of things to work on as human beings. We don't come with just a general love and understanding of each other. We have to keep working on that. And we definitely have to work on the stigma around mental health. Looks like Walter has a question. And Sharon, please ask. I could stay as long as you want.
Walter, let's go to Walter next and then to Sharon.
Yeah, thank you, Richard. Wonderful program, and Kevin. Years ago, I was involved with a health clinic in Palo Alto, California, that used a sliding scale to determine how much people could and should pay for their care. If you came in and you were, you know, poverty level, you didn't have to pay anything. Is that a model that's worked in other places? Is it something that's a possible, you know, could we do more of that? Could we try to help foster those types of situations in different cities?
Yeah, Walter, that's a great question. That was the model of the Venice Family Clinic that I worked in for 4 years and have supported since. But one thing that happened is the development of the federally qualified health center started to provide federal money so that people without insurance and people who might have been on a sliding scale were now getting a health care in a federally qualified health center. Unfortunately, there are not enough of them, and we need more programs like that. And we, you know, I don't know of many clinics that run on a sliding scale anymore, but it does allow people to get healthcare. I mean, if we had a system where everyone was entitled to healthcare, which I do think is a basic human right, you know, Eleanor Roosevelt gave us that, you know, when the UN came up with what are our basic human rights, healthcare certainly was one of them. We wouldn't need places with sliding scales and free clinics. And I'd like to put our clinics out of business, but I don't see it happening anytime soon. But thanks for your comments. Sharon? Hi, Sharon.
Hi, Rich. You know, I sat with you at a reunion, I guess 5 or 10 years ago. Life has gone by, and I listened to your commitment even back then. And I remember Joe and I left and said, this is a true physician. And that's from two physicians who've worked all our lives. You have our great respect and admiration. But I have a question for you and a comment for Walter. Walter, Maryland has the maternity partnership, and it is on a sliding scale. Yeah. And up until 4 years ago, it was incredible. And in the last 4 years, it has worked well, though many of our people who should be taken care of have been afraid to come in because they didn't always have papers. My hope is that it will change again, but it is a truly sliding scale, and we feel that it helps with infant mortality and perinatal mortality. That's just a side note that some of these places do still exist. But my question or my one plea for Rich to talk a little bit about is that he did a beautiful job showing family-centered shelters and how we can help. And I just wanted to point out that there's a specific group even in there that is at greater risk. And those are the newborn babies, because many of the shelters will not allow newborns to be cared for in the shelters. They make noise, they need extra requirements, and you can't send them off to school during the day. So as those of you who work with any of the shelters or getting health care or helping with homelessness, please remember those babies. From what my team does, it can be extremely difficult, and keeping them in a NICU is incredibly expensive and not good for healthcare. And I know you know far more about that than I do, Rich, but they are a specific subgroup that's not well cared for either.
Yeah. Yeah, no, I know, like, for example, the Transitional Living and Learning Center that we work in, they do take moms right straight from labor and not labor and delivery, but from postpartum, and let them bring their newborns. I actually had a nice picture of 3 moms with their newborns that I didn't include, but it's true. I don't think I'm not sure at Haven for Hope if they can get in with a newborn. I don't know the answer to that, but they do actually, the families don't live in those big open dorms that I showed you with all those orange cots, they do get their own little space. You know, it may not be a real apartment. They often don't have a kitchen. They'll have a bedroom and a closet and a bathroom, and you know, and then they go to a general cafeteria for their food, and a lot of our food banks, our San Antonio food bank provides food. But yeah, you know, moms, you know, in this country, if you are pregnant, you should be entitled to Medicaid for your health care, and the baby as well. And that can help, but it doesn't necessarily mean, and when there's the Women's Infants and Children's Program, WIC, or for food, but it doesn't give you a free apartment or a free house. You know, Section 8 housing maybe, but you know, these are tricky things, and we don't have a good safety net. We need more help.
No, we do. And that's really sort of the point. There are fewer shelters that can accept them, and the system is more difficult. And many of these people are already stretched beyond limits. Working the system is very difficult for them. And one easy thing is that sometimes to get your WIC, I'm sure many of you know, but you have to appear with the baby. So we're discharging the baby from the NICU while you can't bring the baby that's still in the incubator to the WIC. So you have to get your WIC and take your newborn baby that's a high-risk baby to prove that that baby's alive.
Yeah, no, we need a lot of help. Are there other questions? Thank you, Sharon. It's nice to see you. Say hi to Joe for me.
I will. He's on call.
Oh, okay. Then he's excused from tonight.
We have a question from Phil Lapel. Phil,
okay.
you want to ask your question?
Yeah, hi, Rich. Great to see you. So how many people do you see successfully transitioning out of homelessness? And what can you say about that and about the kind of support services that are needed for those transitions to the extent that you're seeing successful ones?
Yeah. Well, we've had a few thousand get out of homelessness from Haven for Hope. It's an amazing campus. They put together 100 different nonprofits around our city to work to help people transition out of homelessness. So it's not just a place where they get fed, but it's where they get job training and mental health. And there's a chapel on the campus, and there, you know, people of faith can get together. They actually have different meetings for them. There are people who help them get to Section 8 housing, because housing first is important. It's hard to recover and work on your mental health if you're on the street. So, but there are many people who don't transition out, and we have what's called a courtyard for them. And the expectation is just that we keep them safe. We provide them food, showers, and that's going to maybe be as much as will happen, and access to a psychiatrist who comes every day and works on the courtyard to help the folks. In far as the substance abuse programs, we're seeing very high rates of success in the area of 80%, but we also know that there is a lot of people who relapse, and so there's a lot of relapse as well. These are hard areas. Thanks, Phil, for the question.
I have one other. We're going to wrap this up, folks, because I know that people have to go. But I have a couple more questions, and then we'll take those, and then. But then I think we should probably let Rich move.
I'm okay to keep going, but I think an hour and a half is probably max for everyone.
This is about Kate Gridley had a question. Kate, you want to ask your question?
I was just curious about, thank you for this wonderful program. End of life care was on my mind. I'm a hospice volunteer, but that's a whole nother arena. And I wondered if there are such things as hospices for homeless people, or what is it? End up in a hospital in an anonymous way? What tends to happen?
You know, I actually don't know the answer to that question.
Mm-hmm.
Oh, come on.
You had that quote from Mahatma Gandhi, so it made me think about India and Mother Teresa, the hospices there, the end of life care, but we have nothing like that here in this country.
Yeah, I don't know. You know, over 65, people do qualify for Medicare.
Mhm.
So that helps with the health, with the health care. But again, that doesn't necessarily give them a roof over their head. But I would think if someone has Medicare and is at the end of life, which usually means the last 6 months, that they should be able to be admitted into a hospice because the hospice will get paid by Medicare.
Right.
So I think that that would give
Curious.
them a roof over their head. Yeah, I've not seen anyone in our shelters with a terminal illness that was in the last 6 months. I think they are hopefully are getting into hospice care.
Okay, okay.
But I have seen people who are over 65 who can't get their Medicare because they lost their identification.
Right.
And that is a crazy issue. You know, I had this man, I was going to show the picture, but I grossed out Kate and Kevin earlier. So it's a big tumor on the side of his head. And I couldn't get him the surgery he needed because he didn't have an ID. And it took him 5 months to get his birth certificate so that he could finally get Medicare. That's insane too. So some of the ways people can help is you can help even on sort of these legal issues about helping people getting identification so they can actually get services that they should be able to get.
And that they're entitled to.
And that they're entitled to. This guy worked his whole life.
Great. I have a couple other comments in here. Sue and Nancy, they're not really questions, but I think everybody has seen those comments, correct? So, and I think that they're really, really great, talking about the stigma again, as Sally brought up, and our need as a country and as a community and as a group of people, as citizens of the world, to have compassion and empathy for these people who are struggling. I think I'd just like to take this opportunity to thank Richard again for this incredible evening. And these are really, really tough issues. And some of those photographs I know were difficult for me, but I'm a little oversensitive perhaps. But I just want to thank him again. Thank you all for being part of this wonderful evening. And again, thanks to Kate. And thanks to Pam for taking us on our next journey that'll start March 25th, right, Pam?
Yeah.
All right, great.
Okay. Thank you,
Kevin,
Kevin.
thank you
Kate.
too. And great program, Richard. Thank you.
Yeah,
Okay.
Thanks so much.
So wonderful to see you all. Keep doing all the great things you're doing.
Well, thank you for
Okay.
what you're doing.
Bye.
All right.
Thanks,
bye-bye.
Rich.
Thanks, everybody.
Bye.
Good night, everyone. Good night.